Disproportionality in special education occurs anytime a subpopulation is over or underrepresented within a special education program or disability category. Some minorities and subpopulations have historically been over-identified as having a disability, while other populations have been under-identified. An overrepresentation of minority students, for example, is present within high-incident disability categories, such as emotional and behavior disorders, learning disabilities, intellectual disabilities, and speech and language impairments. These disability categories involve more subjective judgments and therefore are more likely to be impacted by error or contextual influences, which result in under or over identification of minority populations. Historically, African American, American Indian, and low-income students are at an increased risk for over-identification of a disability. Hispanics and Asians are proportionally or under-identified in most disability categories, while whites and Asians tend to be overrepresented in gifted programs. English learners are overrepresented in special education later in the school process, as well as in districts with large English language programs. The Individuals with Disabilities Education Act requires states have policies and procedures intended to reduce over-identification or disproportionate representation of minority groups in special education. In accordance with IDEA, states monitor special education outcomes in 20 different quantitative and qualitative indicators. Two of these indicators are specifically related to preventing disproportional representation in special education. Indicator 9 refers to disproportionate representation of racial and ethnic groups in special education and related services that is the result of inappropriate identification, while Indicator 10 refers to disproportionate representation of racial and ethnic groups in specific disability categories that is a result of inappropriate identification. IDEA also calls for identification of districts with significant disproportionality. While states are required to monitor for disproportionate representation, a consistent national system to evaluate data and determine disproportionality does not currently exist. Individual states determine eligibility requirements for identifying students with disabilities, as well as the procedure and measures used for determining disproportionality. There are three common measures used to identify disproportionality, which include composition index, risk index, and risk ratio. The National Research Council indicated that disproportionality in special education is not problematic when students are accurately diagnosed with disabilities. Yet, as previous examples, which illustrate both over and under identification of students within various ethnic groups, is indicative that some students are inappropriately identified. This is problematic for minority students, though they're at an increased risk for poor outcomes as a result of more restrictive educational placements, demonstration of less academic gains, and an increased likelihood of remaining in special education for more time. Additionally, the under-identification of students in some subgroups may indicate that students' needs are not being addressed through appropriate interventions. Most agree that disproportional representation in special education exists and that it has been the potential to adversely impact students. However, contention exists as to the cause of this imbalance, as well as whom should be responsible for remedying this situation. The overall cause of this disproportionate representation can generally be attributed to either practice-based factors or socio-demographic factors. The fundamental manner in which the situation can be remedied varies depending on the camp with which one aligns. Proponents of practice-based factors believe schools are responsible for disproportionate minority representation. Ball, Sullivan, and Harpner maintain that identification of students with disabilities, not just determined by interpersonal factors which include neurological and physical functioning, but also by intrapersonal factors such as perceptions and behaviors of teachers, access to educational opportunities, and the school culture. This may result in some students receiving a false diagnosis for a disability when one does not exist, while other students who have a disability may remain undiagnosed. Local education practices, including both school and district level practices, may impact the success of minority students. According to Vulgaridis, Fergus, and Thorius, difficulties for minority students may arise when gaps in district and/or school-level educational practices and policies that do not address the needs of students occurs. Furthermore, some policies, like English-only instruction or zero-tolerance policies, may negatively impact minority students. Disproportionality has been linked to insufficient learning opportunities, which occurs when students receive inappropriate instruction. Fergus expressed that the curriculum used with many minority students is inconsistent and ill-articulated. Additionally, oftentimes teachers that work with minority and low-income students have weaker instructional skills, with some of the weakest teachers assigned to the weakest schools. Behan proposed that schools are responsible for this disparity since students have not received substantial educational benefit. Inappropriate intervention and referral practices contribute to disproportionate quantity of minority students in special education as well. According to Fergus, rather than providing interventions to ensure success, many schools use interventions as a pathway towards special education services. On the classroom level, these interventions are inconsistent and unsuccessful, as well as poorly documented with minimal analysis. Vulgaridis, Fergus, and Thorius similarly mentioned that the gaps exist related to both development and implementation of interventions and referrals, resulting in less success. Fergus additionally mentioned that an incorrect and inappropriate administration of various assessments, which are then used as diagnostic tools, is another practice commonly used by schools that negatively impacts minority students. Many educators that work with minority and low-income students do not share the same culture, which at times results in a clash of beliefs with negative implications for the students. Harry and Fenton found education professionals attribute the over-identification of minority students in some special education categories to a combination of 6 contributing factors. These include poor parenting and low parental involvement, poverty and associated disadvantages, intrinsic child deficits, inappropriate or biased practices for referring and identifying students with disabilities, high-stakes testing, and limited classroom resources and support for classroom teachers. It is important to note that of the 6 reasons educators give as justification for students being unnecessarily identified with a disability, 3 of these reasons place blame on the child or the child's family. This substantiates Fergus's contention that teachers blame students and their families for an inability to learn. Many education professors that work with minorities and low-income students view these students as under the paradigm of a deficit model. This view not only results in great proportions of minorities and low-income students placed in high-incidence special education categories, it also prevents students from entering gifted or advanced programs. Vulgaridis, Fergus, and Thorius ascertained that teachers' expectations of a group, for example, Blacks or Hispanics, provides a gauge by which they determine how individuals within that group perform. As a result, teachers tend to hold low expectations for all students in these populations and do not necessarily the challenges and advanced opportunities that students need to succeed. Many teachers, whom students view as broken or deficient, misunderstand and view special education as a program that fixes students who cannot learn, rather than as a program designed to provide accommodations designed to compensate for students' disabilities that allow them to achieve success. An alternate viewpoint ascertains that the socio-demographic factors outside a school's sphere of influence results in a disproportionate quantity of minority and low-income students in special education. The National Research Council and Congress determined that students living in poverty oftentimes face environmental factors and issues that negatively impact their ability to learn. Lawson and Orfield similarly argue sociodemographic data in a school district is strongly associated with the proportion of students identified in special education. Many low-income students who are frequently students of color enter school with decreased vocabulary, which is also proven to predict or impact future success in school. Richard Rothstein argues that students living in poverty are disadvantaged as a consequence, which is a societal problem that schools should not be exclusively responsible to solve. Disproportional representation of minority and low-income groups in special education is a problem with various causes, but this does not negate the school's responsibility to effect a positive educational outcome for these students. Schools are not the cause of the problem, but if we pass blame on to others, like policymakers, rather than stepping forward and trying to address the problem by meeting the needs of all students, then we are hurting students. Racial minority students, as well as those from low socioeconomic backgrounds, tend to have fewer educational opportunities and resources as compared to majority peers throughout their entire school careers, beginning in early childhood. Therefore, schools should increase educational opportunities for these students. Yet, special education services do not typically provide the enriching educational experiences these students need, nor, as Sullivan and Proctor note, are these programs consistently effective. Actually, the special education label is frequently associated with stigma, decreased expectations, and reduced access to general education classroom and curriculum. Additionally, longitudinal studies indicate that students in special education programs continue to fall behind and the academic gap increases over time. Furthermore, high rates of suspension and dropout, as well as post-school unemployment. Sullivan and Proctor contend that special education programming is good for those that need it, students that actually have a disability, but it carries many negative consequences and may even be detrimental to those who do not need it. It is important that we recognize all the factors that result in disproportional identification of minority students in special education. Students' placement in special education is a result of multiple factors, some of which relate to societal factors, while others are related to the education system itself. Schools must endeavor to recognize any shortcomings of previous efforts to minimize disproportionality so that organizational change can be made. Within this context of organizational change, schools should work to increase and improve the effectiveness of general education program with the aim to prevent academic, social, emotional, and behavioral difficulty amongst students. Sullivan and Proctor also propose that schools should evaluate referral processes and practices to safeguard against referrals related to racial bias. Astronome and Sinino maintain that disproportionality is an adaptive problem that cannot be solved solely through prescriptive solutions. Instead, the educational system must adapt and change in order to resolve this problem. Finally, while schools cannot abstain from working towards eliminating the problem of disproportionately high representation of minority students in special educations, schools cannot independently solve this problem. Disproportionality is shared by many systems, including schools, families, districts, and state educational agencies. Therefore, any planned improvements should also involve a collaboration of these systems.